Back now on Newsmax Prime, and for the first time in more than 20 years, the rate of new TB cases is not dropping in the U.S., according to the Centers for Disease Control. In fact, new cases actually rose last year, the first increase we've seen since 1992. Now, officials at the CDC say they're stumped as to why there is an increase, but let's take a look at the map showing where the new cases are showing up. Look, border states by and large. That might suggest, circumstantially, that immigrants, specifically illegal immigrants, could very well be contributing to the rise in tuberculosis. For more on this, we're very pleased to be joined here on the anchor desk by Newsmax Health editor Nick Tate. Nick, of course, also the author of the book, The Baby Boomer Survival Guide. And as a boomer, Nick, I got to get my hands on my own copy. But let me get to this whole topic of tuberculosis.
Yeah.
Is this a dangerous situation?
Absolutely. This is another one of those cases where a disease, an infection that we thought has long ago been vanquished from the U.S. is coming back. And as you see from the map, it's clear that at least from circumstantial evidence, it's the border states that are really taking the brunt. California, Texas, Florida, and New York to a lesser extent. According to the CDC, more than half of the new cases are in foreign-born individuals. And those individuals, they're bringing them into these states where obviously folks who are vulnerable, older folks, younger folks, people who have compromised immune systems are at risk.
So we've got this situation with a spike in TB cases with circumstantial correlation to the immigrant community, illegal and legal perhaps, especially with that one curious sighting or a multiplicity of cases on our northern border. Why do you think, I guess what I want to know is, why haven't we heard more about this? You're sounding an alarm that others are not talking about.
I think it's a surprise because doctors aren't seeing these cases and haven't seen them for many, many years. The idea was that tuberculosis has been licked in this country. Like other infectious diseases, measles are making a comeback, whooping cough is making a comeback. We're seeing MRSA, and now we have to worry about the new virus, Zika, the mosquito-borne virus. All of them are raising awareness in doctors who have not really seen these cases in sometimes 10 and 20 years, and that's why it's coming as a surprise. In some ways, that's contributing to the risk because doctors may not catch them right away. They may not see them. Hospitals may presume it's cold or flu or something else, and so they don't flag it as TB. And TB is highly infectious. It kills about 1.5 million people globally where antibiotics are unavailable. So we really need to be paying more attention to it.
Well, you raised the term antibiotics. And are we ending up with a permutation of TB that is resistant to antibiotics?
It's showing up, yes. TB is largely treatable and curable through long rounds of antibiotics. They sometimes take months. It's not real easy. You don't just take it in a 3 or a 10-day supply of antibiotics. But there are forms of TB, strains of TB they're seeing around the world that is, in fact, resistant to these last resort drugs. So the big fear is if we don't nip this one in the bud before these cases become larger in number, we're going to be looking at a huge public health crisis. In my opinion, we need to be sounding that alarm loudly and aggressively now.
So we're sounding the alarm tonight here on Newsmax Prime, but our viewers say, now wait a minute, that's well and good, you've warned us, but what needs to happen in terms of public health to get a handle on this? If you were to outline priorities, Nick, what would they be?
Well, clearly when we're talking about these porous borders with people coming across the borders without spot checks, public health surveillance needs to be a big part of that. That does happen to one degree or other. If you're applying for permanent residency status, you do have to be subjected to a medical test, including a TB test. But people who come on temporary work visas, students, and obviously people coming across with less than legal means are not getting the attention they need to. So when we talk about immigration reform that protects the borders, we need to not only be talking about the influx of folks that are coming in, but medical surveillance is a key part of that armor.
So I need to amend what I said about border security being national security. It is also health security, public health security. You got to know who's coming into the country.
They're one and the same. Absolutely true. No question about it.
Nick,
Sorry to add another wrinkle to this, but it's the truth.
Well, it's important that we talk about it, which is why we do it here on Newsmax Prime, because as we know, there's the rest of the media, and then there's Newsmax TV. Nick Tate, author of The Baby Boomer Survival Guide. You've given me something else as a baby boomer. I Want to Survive. Great book. And we may have to add a section about TB. No, but we'll continue to monitor this problem. Nick, we thank you very much for your time. And you heard what Nick had to say on this. I'm interested in your response. Do we add public health safety to border security? What do you think? I'd love for you to offer your comments to me. And to do so, here's the way you can tee it up. You can go to the keyboard and send me an email, newsmaxtv.com/comments, or if you're a part of the Twittersphere on Twitter, you can tweet me. Our handle is @Newsmax Prime. And when we continue, she was a nun, and there was none better in terms of using television to spread the word. We'll talk about her next.